now we are briefly moving away from devices that you can touch, and we're going to continue with algorithms and statistics. So Kristjan Krass from Estonia is now talking about algorithms and decision support systems for detecting diseases and indicators for HIV screening. So very much looking forward to this talk.
Well,
thank you.
And first things, thank you. And first things first, thank you, Jakob, inviting me. For me, it was a big opportunity to step back and look from outside to Estonia and to see where it is. And I now know that Professor Peter Ross was last year also here, so giving overview of Estonian situation. But I believe that I might give a bit different perspective because I'm coming from business side and he's coming from academic side, so might be a bit different. So, but you might not know where it is Estonia, is it? Or you know, but it's a small, modest country, and we try to believe that we are bigger than we actually are. We're trying to, but if you look numbers, then you can see that we are only 1.3 million people, and it's 7 times smaller than Austria, and area-wise, we are twice as small as you. And so it's small, but our government really tries to reach out for young talents like you are and to bring into Estonia because we have a lack of IT specialists. And the infrastructure we are building is very supportive in a business-wise, that you can make a business in 10 minutes, you can pay your taxes in 10 minutes from mobile phone, which is quite impressive. Probably you can't do it in America like that. So this is something unique, I guess, in Estonia. But I go to the e-health, and I wanted to see where it stands, and actually has quite a high ratings. And from the Pertselemann Foundation 2019, the Digital Health Index, Estonia is the highest score, which really impressed me because as a business person, I see a lot of challenges and opportunities to develop. Just to give examples, it's hard to data mine, for example, from the electronic health record. We don't have any company who could actually access to patient data at the moment from outside, even when a patient will gives permission to data mine. And then I looked closer and I saw that they measured only policy activity, which is true. Estonia is very active in making policies, and digital readiness, which is we are very ready to do all digital services. And actual data usage is very good. We have internet everywhere, and it's it's like to everybody. And now it's more complex picture, and I want to express that the first digital highway we launched it X-Road 2001. And it was real success from governmental side because we launched on top of it. It's secure. It's all data is unique. We launched different services, and you can see it's nearly 2,000. No, now maybe 3,000 different services from public sector and from business sector, and it's all over the internet and in a secure connection. But for digital health, it makes it complex because we have different institutions like eHealth Foundation who collects the patient information. We have a health insurance who collects the bills, and sometimes you need to put them together, but they use different information systems, and it's not interoperable, and the data quality is often not measured. So when we even get closer to eHealth Foundation, then the papers have shown that the data quality at the warehouse is not that good. It's in a way one-way street that we put a lot of data there, but can we reuse it? Can we analyze it? it is often questioned to me. For example, I tried to query analysis from eHealth Foundation months ago, and I got reply just now. So it takes time for them to analyze the data, and there is no standardized statistics available. And maybe mention to UX, user experience in, for example, GP level is really bad. For example, if they put all data into the local data system, then they can review it quite easily. But if they want to go to central database, eHealth Foundation, then they have a list of medical records, and they have to click one by one. So they're really annoyed by this system, and they don't want to send the information, and they often don't send it because they think it's irrelevant, because it thinks maybe it's a flu or it's not that important problem. So for business-wise, not so sure whether we can get quality data from there and reuse it. Although it could give additional value for e-health and health, gives lives to people. And maybe to emphasize more, I just want to show that eHealth Foundation is, since implementation 2008, it's getting more and more information into the database. You can see that, maybe it's one important point, otherwise I will forget it, that we do have a digital prescription 100%, which is really good service. Everybody can have a digital e-prescription, and doctors do use it very well. I think this is uncommon, but for us it's already new normal, so we don't see it as some special service. It's okay. Of course we have it. Sure, who doesn't? And but it's something we should now look next. And patients do also queries from their side. This is a blue line. Yes, it is blue line. Patient queries it's going up, and people are interested what's going on in eHealth Foundation. What is the status of there? And it's a 5 million medical documentation in eHealth Foundation, and doctors also do check what is in other specialists are doing. Yes, but we don't reuse it. This is one of my key message I want to address. We should use it because it's much added value there, hidden. So now I'm more into our diagnostic match, into switch cares. So it's a HIV screening platform. We know everybody, I think, what is HIV. It's a terrible disease. I don't need to explain here. But the story goes back 3 years ago when Family Doctors Association head Diana Ingerainen said that actually in Estonia it's a worst situation in Europe. It's over 20 people from 100,000 is getting sick year by year, so it's the highest prevalence in Europe. We have to do something. We really have to do it. And as guidelines say that there is some diseases which show up before AIDS actually happening. So it's called indicated diseases, and it's described in medical guidelines. Then she said that why shouldn't we show alerts that you have indicated diseases in your electronic medical health record? So it's quite simple idea to look in electronic medical health record the patterns which really matters. And then when you actually see that, okay, this person have a pneumonia or psoriasis, which could be linked to HIV, we should make a test. And in doing many tests, we will find these sick people who are actually hidden. And why we should do it is that 50% newly diagnosed are often diagnosed late, since the treatment is heavier, you really are more likely to die. But there is so many different HIV indicators, like 400. how can you remember this from head? So computer is excellent to doing that. And this was our first demo. It's actually quite simple. This red dot shows that the algorithm is working. There is this person, Tom Maino, has a indicated disease, psoriasis and pneumonia, and you should make a test. And actually, when you click it and do the test, the alert goes away. So it's, for user experience-wise, it's very simple. But we have to test everything, so we are in a testing period. Preliminary data shows that the testing is going up 4 times from previous. And what is actually, I think, also important, that often people afraid to talk about this personal disease like HIV. It's often linked to your behavior. So it gives doctors confidence to actually raise issues. We were afraid that many people don't want to come into the study, because it's so personal. But actually, from 95% people said, yes, it's no problem, I can be in the study. So it gave also for doctors confidence to offer the high HIV testing also. Yeah, test now. And I believe that with this we can build a better future for all of us. Thank you.
Thank you, Mr. Krass. Are there questions?
Thank you for your presentation. I have just one question. Did you make clinical trials? Where your recommendations come from? So.
It's based on already on medical guidelines. So there is the list of indicative disease is already described in medical guidelines. So no need to do this, but it's evaluation. The process is in a process that maybe next year there will be more diseases linked to the HIV indicators. Yeah, it's a good question. Yeah.
Another one? Well, of course, this list of diseases and the fact that there are so many diseases linked to one reason, which is HIV, is specific to HIV. But are there other diseases which have similar indications where you could use this method too? Could you translate this method to other diseases as well?
That's a very good question. Actually, we have actually thought in COPD. But then the problem comes that there is no specific diseases described in medical guidelines. However, we did like a concilium of doctors who said that this specific disease and this specific symptom could trigger. And then we did a questionnaire from risk groups, and we have a pilot phase for that, yeah.
Well, you could use data mining and algorithms for that too, couldn't you?
Very good, yes. And that's another, that actually we have a lot of text stored in the eHealth Foundation, and one of the things could be that we unstructured text, we could actually find out risk groups, which is like in HIV, like men with men or other sex workers. We could actually make the alert stronger, or this is like you must do for this person, for example. Or yeah, that's true. Okay. Could be.
All right, so ladies and gentlemen, let's watch out for Estonia. A lot of things are happening there. Maybe we can learn a lot from this country. Thank you again.
Thank you. Thank you, everybody.